Hello and welcome. Today, we're diving into a condition that can be uncomfortable and concerning rectal prolapse. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. So, let's get started on understanding rectal prolapse. So, what exactly causes this to occur? Rectal prolapse is often a result of a weakened or stretched support structure within the pelvic floor. Think of it as a hammock that's lost its tautness. Several factors can contribute to this weakening. Chronic constipation or straining during bowel movements puts significant pressure on the rectum over time. Pregnancy and childbirth, particularly multiple pregnancies, can weaken pelvic floor muscles. Aging naturally leads to a loss of tissue elasticity and muscle strength. Certain medical conditions, like chronic obstructive pulmonary disease, OPD, due to chronic coughing, cystic fibrosis, or neurological disorders that affect bowel control, can also increase the risk. In some cases, a previous surgical procedure involving the rectum or anus can be a contributing factor, though this is less common. Sometimes, a specific cause isn't identifiable and it is idiopathic. To understand rectal prolapse, it's important to grasp what's happening inside. The rectum, the final section of the large intestine, normally stays securely inside the body. With rectal prolapse, the rectum turns inside out and protrudes through the anus. This can occur because of the weakening of the muscles and ligaments that hold the rectum in place, as well as weakening of the anal sphincters. It's like a sleeve being pushed out from the inside. The prolapse can involve just the lining of the rectum, mucosal prolapse, or the entire thickness of the rectal wall, full thickness prolapse. This protrusion can lead to various symptoms and complications, which we'll discuss shortly. Rectal prolapse can affect anyone, but it's more prevalent in certain groups. It's significantly more common in older adults, particularly women over the age of 50. This is often attributed to the effects of aging, weakening pelvic floor muscles due to multiple pregnancies, and hormonal changes after menopause. While less common, rectal prolapse can also occur in children, often associated with constipation or cystic fibrosis. It is important to note that the incidence varies widely depending on factors like age, sex, and underlying medical conditions. Therefore, consulting with a healthcare professional for specific prevalence data in a particular demographic is essential. The signs and symptoms of rectal prolapse can vary depending on the severity of the prolapse. Initially, you might notice a feeling of fullness or pressure in the rectum. As the condition progresses, you may see a reddish mass protruding from the anus, especially after bowel movements. This protrusion might initially retract on its own but, over time, may require manual repositioning or remain permanently outside. Other symptoms can include fecal incontinence or difficulty controlling bowel movements, constipation, bleeding from the rectum, and mucus discharge from the anus. The persistent discomfort and embarrassment associated with these symptoms can significantly impact a person's quality of life. Diagnosing rectal prolapse typically involves a physical examination by a doctor. The doctor will likely ask about your medical history, bowel habits, and any relevant symptoms. During the physical exam, the doctor will visually inspect the anus and rectum, often asking you to strain as if you're having a bowel movement to see if the prolapse occurs. In some cases, further tests may be needed to confirm the diagnosis and rule out other conditions. These tests can include a sigmoidoscopy or colonoscopy, which uses a thin, flexible tube with a camera to view the inside of the rectum and colon, and an rectal manometry, which measures the function of the anal sphincter muscles. Defecography, a specialized type of X-ray or MRI performed during simulated defecation, can also be used to assess the degree of prolapse and identify any associated abnormalities. There are different classifications, but broadly we can categorize rectal prolapse as either partial or complete. A partial prolapse, also known as mucosal prolapse, involves only the lining of the rectum protruding through the anus. A complete prolapse, also called full thickness prolapse, involves the entire wall of the rectum protruding. Differentiating between these types is crucial because it influences treatment strategies. The degree of prolapse, whether it only occurs with straining or is constantly present, also influences management decisions. Treatment for rectal prolapse depends on the severity of the condition and the individual's overall health. For mild cases, conservative management may be sufficient. This includes dietary changes to prevent constipation, such as increasing fiber and fluid intake, and avoiding straining during bowel movements. Pelvic floor exercises, also known as Kegel exercises, can help strengthen the muscles that support the rectum. If conservative measures aren't effective, or if the prolapse is severe, surgery may be necessary. There are several surgical approaches, including abdominal procedures, which involve repairing the prolapse through an incision in the abdomen, and perineal procedures, which are performed through the anus. The specific surgical technique will depend on the patient's age, overall health, and the surgeon's expertise. The goal of surgery is to restore the rectum to its normal position and improve bowel function. While it's not always possible to completely prevent rectal prolapse, there are steps you can take to reduce your risk. Maintaining a healthy diet rich in fiber and staying well hydrated can help prevent constipation and straining. Strengthening your pelvic floor muscles through regular Kegel exercises is also beneficial, especially for women after childbirth. Promptly treating any underlying medical conditions that contribute to constipation or straining, such as chronic cough, is important. If you experience any symptoms of rectal prolapse, seeking early medical attention can help prevent the condition from worsening. The prognosis for rectal prolapse is generally good, especially with appropriate treatment. Surgical repair is often successful in restoring normal bowel function and improving quality of life. However, recurrence of prolapse is possible, particularly in older adults or those with weakened pelvic floor muscles. Recent research is focusing on improving surgical techniques and developing new methods for strengthening pelvic floor muscles. For example, minimally invasive surgical approaches, such as laparoscopic and robotic surgery, are becoming increasingly popular due to their smaller incisions, reduced pain, and faster recovery times. Research is also exploring the use of biofeedback and electrical stimulation to improve pelvic floor muscle function. This research may hold promise for improving the long-term outcomes for individuals with rectal prolapse. Always consult with a healthcare professional for personalized advice and treatment options.